Welcome to the topic, drugs for lipid disorders. There are three classes of the lipids, which are named as the triglycerides, steroids, and phospholipids. Like if we gonna be breaking the lipids, we have fatty acids and glycerides. The fatty acids can be further saturated and unsaturated. Glycerides can be the neutral glycerides or the phosphoglycerides. And the third, the lipids can be non-glyceride lipids or the complex lipids. Complex lipids can be lipoproteins and non-glyceride lipids as waxes, sphingolipids, steroids, sphingomyelins, and glycolipids. So as this chart is showing us, these all are the names of the lipids. So lipoprotein levels, they're important predictors of the cardiovascular system. If we see here, this is showing us that these are the low density lipoprotein particles, which are going to go into our body, into the blood and arteries, and there they're going to be forming the atherosclerotic plaque, from where the lipid disorders starts. High cholesterol is one of the other reasons for the lipid disorders that we say in the artery. We always get the cholesterols, more cholesterol deposited, more plaque deposited because of the unhealthy food that we eat. So the greater the amount of the cholesterol circulating in the blood, the greater the risk of the cardiovascular disease. Circulating the cholesterol binds to the vessel walls, increasing the plaque buildup as years passes down. So in the lipids are packaged for travel through the blood in the lipoprotein complexes. High VLDL and LDL, they are associated with an increased incidence of the cardiovascular disease, whereas HDL provides a protective effect. When we say VLDL and LDL, HDL, it is abbreviated as very low density protein. LDL is low density protein and HDL is high density protein, high density lipoprotein. So this is our lipids. They are telling you the green color is representing the triglyceride, the purple is protein, the skin color, the pink color is the phospholipids, and the yellow is the cholesterol. So we can see in the HDL, let's start from here, the green portion, that is the triglycerides in HDL. If a person you have HDL, high density lipoprotein, always the triglycerides are the minimum and the protein is the maximum. In the LDL, the protein is also getting down, but what is maximum? The yellow thing, that is cholesterol. So LDL means the cholesterol is too much. In case of VLDL, you can see triglyceride is too much. So all these are kind of the different lipids. So lipid levels can often be controlled through the lifestyle changes. Definitely a healthy lifestyle means non-smoking, eating a balanced diet, control weight, getting physical activity. We should be doing deep breathing, playing sports. If we eat organic food, we take the sleep enough, we drink more water. These are all the different lifestyles that can control the irregular levels of the lipids in the body. If we go and check the lipid profiles, the tests, so how much the values should be in our body. For the total cholesterols, if we check, the desirable is 6 millimoles per liter, and if it's less than 5 now coming up, it's intermediate. If it's coming more or less, then it is high risk. So total cholesterol should not be lower. Then is LDL, low density lipoprotein cholesterol. In this, the 3 value is optimal, 4.5 is low risk, 3.5 is intermediate risk, and more than 2 is high risk. Again, it should not be lower values. Then we have high density protein, that is HDL cholesterol. If it's more than 1, it's high risk. If it's less than 1, it's desirable. Triglycerides, if it's more than 150, it's normal. 150 to 199, it's intermediate risk. 200 to 499 is high risk. And less than 500 is equal to like very high risk. Then in these cases, who we have to screen? Men more than or equal to the age of 40 years of age, the women more than equal to 50 years of age, or the post-menopausal women. They consider earlier in the ethnic groups at the increased risk, such as South Asians or the First Nation individuals. We are more prone to the high lipid cholesterol levels. Or all the patients with any of the following conditions, regardless of age, like If a person is a current cigarette smoker, he has diabetes, she has arterial hypertension, family history of premature cardiovascular diseases, primary history of hyperlipidemia, erectile dysfunction, chronic kidney disease, inflammatory disease, HIV infection, chronic obstructive pulmonary disease, which is abbreviated as the COPD, clinical evidence of the atherosclerosis or abdominal aneurysm, clinical manifestation of the hyperlipidemia, obesity, the person who has the body mass index more than 27. So any of these conditions, the people have to be screened for the lipid profile. Now, therapeutic lifestyle changes include the increased physical activity, which raises the HDL levels and lowers the triglycerides. If you remember the picture that we see, the HDL, it means that you have the higher proteins in them. So it will increase the HDL, the good one, and lower the triglycerides. It also we have to maintain the optimum weight because the obesity is the major risk factor for the coronary heart disease. And then we have to reduce the dietary saturated fat to 7% of the total caloric intake every day. Other than that, we should reduce the cholesterol intake to less than 200 milligrams per day. We should increase the intake of the whole grains, vegetables, and fruits so that total dietary fiber is 10 to 25 grams per day. And we should reduce or eliminate the tobacco use as well. So these are the common examples that of the drug statins, which is the main drug of the choice for the reducing blood lipid levels like Zocor, Simvastatin, Rosuvastatin, Pravastatin, Fluvastatin, Atorvastatin, Pitavastatin. So these all end with the statins. These are the drug of choice for reducing lipid levels. Other than that, they revolutionize the treatment of the lipid disorders, and their effects are dramatically 20 to 40% reduction in LDL cholesterol levels about the statins. And they also decrease the LDL cholesterol levels in the blood. Then in the statins effect, we also see that they lower the triglyceride levels, they lower the VLDL levels as well, and they raise the good HDL levels. So the first ring that we see in which we have more of the protein and less of the fats and triglycerides and cholesterol. So that one is called as the good cholesterol. So good HDL cholesterol levels are being raised by the statins. They reduce the incidence of the serious cardiovascular related events by 25% to 30%. Then also the statins, they act by inhibiting the HMG-CoA reductase enzyme in the body. What happens here? If you see in this picture, acetyl-CoA, it combines with HMG-CoA, and HMG-CoA reductase inhibitor will go to the cholesterol, and then it will, from the gallbladder, it goes to the bile salt, from the bile cells, it goes to out of the excretion. So this is how these drugs act, and they take the fats and the extra lipids out of the body via excretion. Then the bile acids can increase the cholesterol excretion and reduce the low density lipoprotein levels. If we see the path of the bile acids, what they do actually in the bile acids, gluconeogenesis decreases, glucose output decreases, glucose uptake increases, and glycogenolysis increases. So they all are, you can see here, it is affected by, if it's increasing the glucose uptake, insulin sensitivity, and energy expenditure. They also increase the glucose uptake, energy expenditure, insulin secretion, excretion, and the food intake, it needs to be decreased. So bile acid is playing a pretty much good role in our lipid disorders. Then these bile acids, they are the substances that aid the digestion of the fats. Once bound in the intestine, the cholesterol in the bile acid is eliminated in the feces. It is no longer considered the first-line drug for the hyperlipidemia, but sometimes it is combined with the statins for the patients who are unable to achieve the sufficient response from the statins alone. Then another drug is the nicotinic acid. It can reduce the triglycerides and the LDL cholesterol levels. So it is nowhere anything doing with the HDL. For example, nicotinic acid, nicotinamide, and nicotinamide riboside. So nicotinic acid is also called as the niacin. It is a water-soluble B complex vitamin. The primary action is to decrease the VLDL levels. It also reduces LDL cholesterol. It also reduces the triglycerides and increases the HDL levels. But it has also the adverse effects. The adverse effect is flushing or hot flashes. It's almost 100% of the time with this drug. Then we have the fibric acid agents. They lower the triglyceride levels, but have very little effect on the LDLs. For example, like fibric acids is bezafibrate, fenofibrate, gemfibrozil, ciprofibrate. And this is the structure of the triglyceride that we see, on which the fibric acid drugs, they are going to act and solve this out. So fibric acid agents or fibrates, they are largely replaced by the statins. They are sometimes used in combination with the statins, and they are the drug of choice for treating the extremely high triglyceride levels. Then foods to eat more or less of is eat more foods of these foods, like omega-3 fatty acids from fish and plant sources. Fish should be eaten more, poultry without skin, lean beef, skim or low-fat milk, sherbet or ice milk, egg whites only, steamed vegetables, baked potatoes, and clear soups. Eat less of sausages, organ meats, liver, whole milk, ice cream, egg yolks, buttered or fried vegetables, French fries, creamed soups, and saturated fats like butter, coconut oil, palm oil, and the lard, bacon fat. Other than that, we should not be eating cheesecake, pastries, donuts, potato chips, refined carbohydrates, and sugar, eggs, and bacons. We should not be eating much of these. What should be eating otherwise? Should be unsaturated vegetable oils, corn oil, canola oil, safflower, sesame oil, sunflower oil, olive oil, or soya bean. We should take the angel food cake of more, graham crackers, animal crackers, fig bars, vanilla wafers, lady fingers, pretzels, air popcorns, bagels, English muffins, pancakes, or cereals with the low-fat milk and the fruit. They should be added up in your food. Now, fibric acid agents or fibrates, how they act on the body, what are their mechanism of action? The first is the niacin. It decreases both the VLDL and the LDL levels. Then we use the statins. They interfere with HMG-CoA reductase, the critical enzyme in the biosynthesis of cholesterol. Then we have ezetimibe that blocks the absorption of cholesterol from the small intestine. And we have the bile acid sequestrant like cholestyramine. They bind the bile acids, thus increasing the excretion of the cholesterol in the stool. So this is how the bile acids, they're going to take into the dietary lipids, they're going down into the intestines, and over there, they're going to be blocking the absorption, and then finally, they're excreting out in the feces. The new approaches to treat the hyperlipidemia also include the drug that we just talked about, ezetimibe, and also sometimes the fixed dose combination therapies also. So these new approaches includes the ezetimibe, which is called as Zetia. It acts on the small intestine to block the absorption of the dietary cholesterol. LDL cholesterol and triglyceride levels are reduced with a slight increase in HDL cholesterol. Combining drugs from the two different classes in a single tablet, and combining an antihypertensive agent with an anti-hyperlipidemic drug. So the drugs used for the dyslipidemia, we use bile acid resins, that is the cholestyramine, cholestyramine, or cholecyvalum. Cholesterol absorption inhibitor like ezetimibe, fibrates, bezafibrate, fenofibrate, gemfibrozil. HMG-CoA reductase inhibitor is atorvastatin, fluvastatin, lovastatin, pravastatin, rosuvastatin, simvastatin. They end with the statins. And then the niacin derivative, we use the niacin, also called as the nicotinic acid derivative. In this chapter, we understood about the three classes of the lipids, lipoproteins, important predictors of the cardiovascular disease. We understand the lipid control should start through the lifestyle, then proceed to the statins if not success. We use bile acids, nicotinic acids, fibric acids, ezetimibe, and all other lipid-lowering agents. And these all agents have the different mechanism of actions that we studied in this all video. Thanks for watching.